Hello, everyone. I'm Tanya Rivero. Thank you for joining us. Today, we are seeing both tragedy and triumph as we follow the disease that has dominated so much of our lives this year. According to Johns Hopkins University, the coronavirus has now killed more than 300,000 people in the United States. The news came just hours after the first vaccine doses made it to the American public. Right now, 2.9 million doses of Pfizer's coronavirus vaccine are being distributed across the country. A critical care nurse in New York was among the first to get the shot. Other healthcare workers and people in nursing homes are the top priority. David Begnaud reports from the University of California Davis Medical Center in Sacramento, where workers are eager to be vaccinated.
How do you feel about getting the shot? How are you feeling right now?
I want to clap my hands. I'm so excited. I've been waiting for this.
Eva Teniola, who's been a nurse for 15 years, is anxiously standing by for that call, which so many healthcare workers have been waiting for. She is going to be the first person to get the coronavirus vaccine at UC Davis.
As a caregiver, I've witnessed the worst scenario. That's why I've been waiting for this vaccine, because I believe this would end this pandemic. Thank you, son.
She says she's doing it for the safety of her own family, including her son, Raphael. She's been told that when the call comes, they want her at the hospital in 30 minutes.
What we have here is an amazing setup. It is basically an assembly line.
Dr. David Begnaud is CEO of UC Davis Health.
Why such a race?
Well, every single day matters.
He says they plan to vaccinate about 1,000 frontline workers every day, starting with those who work in the emergency department.
This is probably the most exciting day of 2020, maybe the most exciting day in the last 20 years. The number of people who are dying every single day is huge, and the vaccine is our way back.
Pfizer partnered with UC Davis back in August to carry out part of their vaccine trial, testing the vaccine. These 4 people were all involved. None are aware of whether they got the real thing or the placebo, but Jessica Hallstrom and Nicolette Santiago say they had symptoms that lasted about a day or two.
I had really intense chills, a little bit of nausea, headache, a lot of just shivering.
For Professor Rafael Sanchez and Dr. David Cook, the side effects were minimal.
What would you all say to Americans who will watch this and say, you know, I don't want to be the first?
So I get a lot of statements from my patients over the years saying, I don't want to be a guinea pig, especially my patients of color and from communities that historically have cause and reason not to trust healthcare. Yet I volunteered for this trial so you can take this vaccine and help turn the tide in your communities.
I remember Dr. Cook saying, we were the guinea pigs so that you don't have to be. This is the room where the vaccines will take place at UC Davis Hospital. All chairs socially distanced. They're aiming to do 1,000 injections a day. They have had nearly 750 employees infected with coronavirus since the pandemic started. And that is part of the reason they are moving so fast. I mean, literally, when they get the shipment, they want to start vaccinations within a 2-hour period. In terms of how they're tracking that shipment, it's just like you track Christmas gifts. They put in that FedEx number and watch the plane fly. David Begnaud, CBS News, Sacramento, California.